I am not a government employee, I'm not a reporter, and I am not connected with any federal or state agency. All information in this video comes from publicly available government sources to help you stay informed. Always verify your personal eligibility on official government websites. I am Eric, and you're watching Income for Seniors. SOC Social Security and Benefits 2026. The changes that will affect your wallet. Did you know that starting this December, millions of Americans will see 2 Social Security checks hit their account in the same month? And that's just the beginning. If you receive Social Security, SSI, SSDI, SNAP, or Medicare, or if you know someone who does, the next 60 seconds could literally change how much money you receive in 2026. Here's what most people are missing. While everyone is talking about the 2.8% cost of living adjustment, there are 5 other major changes happening right now that could either increase or decrease your benefits. And most people won't even notice until it's too late. I'm talking about changes to eligibility rules, payment schedules, work requirements, and even restrictions that could affect over 1 million immigrants currently receiving benefits. By the end of this video, you'll know exactly how much more money you'll receive in 2026, the specific dates your payments will arrive, critical deadlines you cannot miss, and which changes could save you or cost you thousands of dollars. So if you or anyone you love depends on federal benefits, do not skip any part of this video. And make sure you hit that subscribe button right now, because we break down these complex policy changes every single time they happen, so you're never caught off guard. Let's dive in. The 2026 Social Security COLA increase. Let's start with the headline everyone's been waiting for, the 2026 Cost of Living Adjustment. The Social Security Administration has officially announced a 2.8% COLA increase for 2026, affecting nearly 71 million Social Security beneficiaries and 7.5 million SSI recipients. Now, before you calculate what that means for you, here's the critical detail most people miss. What does 2.8% actually mean in dollars? For the average retiree receiving Social Security, your monthly check will increase from $2,015 to $2,071. That's an extra $56 per month, or $672 per year. For married couples both receiving benefits, you're looking at an average increase from $3,120 to $3,208 monthly, an extra $88 per month, or $1,056 annually. But here's the catch that nobody's talking about. The Medicare Part B premium increase. While your Social Security is going OP by $56, your Medicare Part B premium is also going up from $185 to $202.90 per month. That's an $17.90 increase. Do the math with me. $56 increase minus $17.90. Medicare increase $38.10. Actual increase in your take-home benefit. So your real raise, it's about $38 per month, not $56. This is why you need to watch our channel. We tell you what really matters. When will you see this increase? Here's the payment schedule for Social Security recipients, retirement, survivors, SSDI. Your COLA increase starts with payments issued in January 2026. Payment dates depend on your birth date. O born 1st 10th, January 8th, 2026. O born 11th 20th, January 15th, 2026. O born 21st, 31st, January 22, 2026. If you started receiving benefits before May 1997, January 3rd, 2026. For SSI recipients, your increase arrives earlier on December 31st, 2025. That's right, you'll get your January 2026 payment early because January 1st is a federal holiday, the double payment December phenomenon. And this brings us to something huge for SSI recipients. In December 2025, SSI recipients will receive 2 payments. 1, December payment on December 1st, 2025, current rate, $9.67 for individuals. 2, January 2026 payment on December 31st, 2025, new rate, $994 for individuals. This means if you receive both Social Security and SSI, you could see 3 deposits in December, your regular Social Security payment plus 2 SSI payments. If you want to know exactly when your payments hit every month, subscribe and turn on notifications, because we post payment calendars every single month. SSI and SSDI payment amounts for 2026. Now let's break down the exact amounts you'll receive in 2026 for SSI and SSDI. SSI, Supplemental Security Income, 2026 rates. SSI, provides benefits to people with limited income and resources who are disabled, blind, or age 65 or older. New 2026 SSI amounts. Individual, $994 per month, $11,929 annually, up from $967 in 2025. Couple, $291 per month, $17,892 annually, up from $450 in 2025. Essential person, $498 per month, $599 annually. Eligibility requirements remain. Limited income, generally less than $987 per month, including other benefits. Limited resources, $3,000 for individuals, $4,500 for couples with elderly or disabled members. Must be U.S. citizen or qualified non-citizen. Important. Some states add supplemental payments on top of federal SSI, so your actual amount could be higher depending on where you live. SSDI, Social Security Disability Insurance, 2026 rates. SSDI is different. It's based on your work history and what you paid into Social Security through payroll taxes. Average SSDI payment in 2026, approximately $1,580 per month with the 2.8% increase. Maximum SSDI payment, $4,152 per month, only for very high earners. Most SSDI recipients receive between $200 and $600 per month. Here's what most people don't understand about SSDI. Your payment is based on your average indexed monthly earnings over your highest earning 35 years. So two people with disabilities could receive very different amounts based on their work history. To qualify for SSDI, you need sufficient work credits, typically 40 credits over 10 years, a condition meeting SSA's strict definition of disability, to be unable to work due to your condition, critical earnings limits, changes for 2026. This could affect your benefits. If you're receiving benefits and considering working, listen carefully to these new earnings limits. For those under full retirement age, can earn up to $24,308 in 2026 before benefits are reduced. SSA deducts $1 for every $2 earned over this limit. For those reaching full retirement age in 2026, can earn up to $65,160 before the month you reach full retirement age. SSA deducts $1 for every $3 earned over this limit. After full retirement age, no earnings limit, work as much as you want with no reduction. The work credit rule for 2026. The amount you need to earn to get one work credit is increasing to approximately $1,810, up from $1,730 in 2025. You can earn a maximum of 4 credits per year. SNAP benefits, food stamps, 2026 updates. Now let's talk about SNAP, the Supplemental Nutrition Assistance Program, formerly known as food stamps, because there are major changes happening that will affect over 42 million Americans. 2026, SNAP maximum benefit amounts. For a family of 4 in the 48 contiguous states and DC, maximum benefit $994 per month, up from $973 in 2025. Alaska families, $1,285 to $119.95, depending on location. Hawaii families, $1,689 per month. Guam families, $1,165 per month. U.S. Virgin Islands, $278 per month. For a single person, average benefit, $188 per month, or about $617 per day. Minimum benefit increased to $24 per month, up just $1 from 2025. 2026, income eligibility standards. Gross monthly income must generally be at or below 130% of the poverty line. One person, $144 maximum monthly income. 2 people, $2,353. 3 people, $2,961. 4 people, $3,569. Each additional person, add $608. Net income after deductions must be at or below the poverty line. Asset limits, $3,000 for most households, $4,500 for households with elderly or disabled members. Many states have eliminated asset tests entirely, standard deductions for 2026. The standard deduction increased to $209 for households of 1 to 3 people. Other important deductions, 20% of earned income, medical expenses for elderly disabled members, childcare costs, excess housing costs, if rent and utilities exceed 50% of net income. Homeless shelter deduction, $198.99 per month. The biggest SNAP change, new work requirements. Here's what almost nobody is talking about, and it's huge. Starting in 2026, SNAP work requirements are expanding to affect approximately 1.2 million more people. New rule, Adults ages 55 to 64 without dependent children must now prove they're working at least 20 hours per week or participating in approved training programs. Otherwise, they can only receive SNAP benefits for 3 months in a 3-year period. Who's exempt from work requirements? Parents or caregivers with dependent children, people with disabilities, pregnant individuals, or people unable to work due to physical or mental limitations. State-specific changes. Texas example. Starting April 1st, 2026, Texas. SNAP recipients will not be able to purchase candy, drinks with artificial sweeteners, drinks with 5+ grams of added sugar. This is part of a federal waiver approved for Texas to encourage healthier food choices. Current SNAP uncertainty. This affects payments. Now, there's an ongoing government funding situation that has caused concern about SNAP benefits. The USDA has issued guidance to states about potential payment delays. If you receive SNAP, 1. Check your state's SNAP website regularly. 2. Sign up for text alerts from your state agency. 3. Contact your local SNAP office if payments are delayed more than 3 business days. Subscribe to our channel because we'll post immediate updates if there are any SNAP payment delays or changes. Medicaid and Medicare changes for 2026. Now we're getting into healthcare, and this section contains some of the most controversial changes coming in 2026. Medicare Part B premium increase. As we mentioned earlier, 2026. Premium, $200.90 per month, up from $185 in 2025. That's a $17.90 a monthly increase, or $204.80 per year. This premium is automatically deducted from your Social Security check. Major changes to immigrant eligibility. This is where things get serious. Starting in 2026, there are drastic changes to who can receive Medicaid and Medicare based on immigration status. Starting October 1st, 2026, federal Medicaid and CHIP funding will only cover U.S. citizens, lawful permanent residents, green card holders, after completing the 5-year waiting period, Cuban, Haitian entrants, COFA citizens, Compact of Free Association Nations. Who loses Medicaid eligibility on October 1st, 2026? Refugees, asylees, people granted withholding of removal, survivors of domestic violence with VAWA status, survivors of human trafficking with T visas, people with temporary protected status, TPS, DACA recipients, they already lost marketplace eligibility. This affects an estimated 1.4 million lawfully present immigrants who will lose health coverage. Medicare changes for immigrants. Effective immediately for new enrollees. Medicare eligibility is restricted to the same narrow group as Medicaid. For current Medicare enrollees who don't meet the new requirements, you have until January 2027 to transition off Medicare. That's an 18-month window from the law's enactment in July 2025. ACA Marketplace, Obamacare, changes. Starting January 1st, 2026, lawfully present immigrants with incomes below 100% of federal poverty level lose eligibility for premium tax credits, subsidies. Starting January 1st, 2027, most lawfully present immigrants, except the narrow group mentioned above, lose eligibility for premium tax credits entirely. This means they can still purchase marketplace insurance. They just won't get financial help. Emergency Medicaid changes starting October 1st, 2026. The federal reimbursement rate for emergency Medicaid in expansion states drops from 90% to the state as a regular FMAP rate. This shifts costs to states and could affect how hospitals handle emergency care for immigrants. What this means for you. If you're an immigrant receiving benefits, 1. Check your immigration status against the new eligible categories. 2. Contact your state Medicaid office before October 2026. 3. Look into state-funded programs. Some states, California, Colorado, Illinois, Minnesota, New York, Oregon, Washington, and D.C., offer state-funded coverage. 4. Explore community health centers that provide care regardless of immigration status. If you're not an immigrant but receive Medicare, be aware that these changes could affect overall insurance costs and provider networks as more people become uninsured. Unemployment insurance. Updates for 2026. Let's talk about unemployment insurance, because several states have made major changes for 2026. New York, massive benefit increase. New York just made one of the largest unemployment benefit increases in the nation. Starting October 2025, maximum weekly benefit, $869, up from $504. That's a $365 per week increase, or $160 per month if you qualify for the maximum. For 2026, the taxable wage base increases to $13,000 per employee. UI contribution rates for employers will decrease due to the state paying off federal debt. New York employers will save approximately $100 per employee in 2026 and $250 per employee in 2027 because the state paid off its $5.7 billion federal UI loan. Michigan, phased benefit. Increases. Michigan's unemployment benefits are increasing in phases. Current, 2025, $446 per week. Maximum, 2026, $530 per week. Maximum, 2027, 6 full terms per week. Maximum. Duration increased from 20 weeks to 26 weeks maximum. Starting in 2028, benefits will be indexed to inflation annually